Hello, welcome to today's presentation, Stop the Bleed to Save a Life, presented by Garrett Cordes, Injury Prevention Coordinator with the Trauma Program at Washington Health. Garrett is the Injury Prevention Coordinator at Washington Health, where he develops and leads programs to reduce preventable injuries across all ages in the community. With over 13 years of experience as a paramedic, he works closely with the local EMS partners to support coordinated care, outreach, and education. He also provides Stop the Bleed training for staff and community members to promote early hemorrhage control and emergency readiness. His work is focused on improving safety, empowering individuals, and strengthening community health through partnership and education. Please welcome Garrett Cordes.
All right, thank you so much for joining me today. I'm very excited to be here to share some of these life-saving tips on how to stop bleeding for injured patients. This is a fantastic presentation that was created by the Committee on Trauma with collaboration from the American College of Surgeons, the American College of Emergency Physicians, the National Association of Emergency Medical Technicians, and the Committee on Tactical Combat Casualty Care. I just do want to advise before we start, some of these images shown might be a little disturbing during this presentation, and we'll go through the presentation and I'll advise when some of those disturbing images might show up. Perfect. So why do we need this training? The most important thing is that the #1 cause of preventable death after injury is bleeding. So a lot of times after a traumatic injury, whether that is a blunt trauma like a car accident or a penetrating injury, bleeding significantly increases the likelihood of mortality in these patients. So I'd like to go over where can we use this training. And the greatest part of this training can be used anywhere. It can be used in the home, in the office, out on the street while you're driving or walking. This could be happening due to violent injuries, accidental injuries, falls, pretty much anything you can think of where you can get hurt. This training can be very important. So we have two goals that we really want to focus on today. The first goal is to identify and recognize what life-threatening bleeding is. And the second one is to take steps to stop the bleeding. And we're going to learn to do that through pressure, packing, and use of tourniquets. So first, trying to look at how to identify what life-threatening bleeding looks like. In your body, you have about 4.3 liters of blood in your body. So to identify what life-threatening bleeding looks like, we really focus on, if you can imagine a can full of soda or water, pouring that can out on the ground, and that kind of amount of fluid that's on the ground, that's what life-threatening bleeding looks like. On top of that, we also want to look like how the patient is bleeding. Is this spurting blood that comes from the artery? That's going to be life-threatening bleeding where someone can hemorrhage in seconds that can lead to death. If it's pooling blood, it's a little bit slower coming from the veins, or oozing blood usually comes from capillaries or muscles. The faster you see someone bleeding or spurting blood is really life-threatening bleeding, and we want to take action immediately. Before we jump into actually how to help patients, we want to make sure that we're safe. So your safety is the first priority. If you're injured, you can't help someone else. So I always like to imagine that we see someone maybe us crossing the street and they were hit by a car. If we run out without looking at any dangers that are out there and we run out and try to help them and all of a sudden we were hit by another car, we're not helping that situation at all and we can't help that patient that's on the ground. So we want to make sure that our scene is really safe before we go out and help somebody. If that's a couple extra seconds to have someone go over and stop traffic while we go out into the middle of the road, or having another bystander kind of look out for us while we're helping the patient, that's the best thing to do. If we don't keep ourselves safe, we can't help anybody else. If the situation changes or becomes unsafe, we really want to take care of ourselves and have a lot of autonomy in that to move ourselves to safety. And if we can take the patient with you, but our safety is always going to be the #1 priority. Additionally, safety is not just from the physical elements that are on the scene. We also want to keep ourselves safe from any kind of bloodborne pathogens. Your skin is a great protector for any kind of bloodborne pathogens, but if we have any open cuts or wounds, there is a possibility of having some kind of infection from the patient's blood come into your body. So the biggest thing, we want to wear gloves if they're able. If we do get some gloves on you, we just want to clean that area with soap and water and talk to your healthcare provider that you had some blood on you, and they'll give you further directions on any additional care you might want to consider. So the ABCs of bleeding. So these are very simple things to remember. We want to call 911 first. We want to identify where the bleeding is, and we want to start to compress that bleeding. So first is alerting 911. So calling 911 is a very simple process. It can be done from any phone or any cell phone. The biggest thing that we want to do when we call 911 though is know exactly where our location is. 911 operators can't send help out to where we are unless they know exactly where we are. So knowing your address, maybe a cross street where you are, or any kind of landmarks are really important to identify and let the dispatcher know as soon as possible. They have really good algorithms that they use to kind of question what kind of emergency this is, additionally where your location is and what kind of resources they want to send out to the scene. So the biggest thing is knowing where your location is and what type of emergency it is. When people call 911, that operator doesn't know if this is a police emergency, a medical emergency, a fire emergency, or a lot of other areas that they need to cover. So they might ask you a lot of questions about what's going on with the patient, giving you instructions on how to help them. It might seem like it's taking a long time, or they're asking you additional questions you might think are not necessary, but behind the scenes, they're sending over those resources to help you while you're talking to them. So they'll send out the police department, fire department, and ambulance while you're still talking to them and they're going over instructions. Typically, fire department, police department should be on scene within about 2 to 5 minutes for most emergencies. The B for our ABCs is bleeding. So this is one of the disturbing images. So it's a laceration to the patient's leg. So we really want to identify how we identify what bleeding looks like and then other sources of bleeding as well. So as mentioned, we really want to look for the source of bleeding. So if we see somebody that's on the ground or bleeding, we want to identify, are they bleeding from their leg, from their torso, from their head, and what type of bleeding it is. As we talked about before, there are different types of bleeding. Fast bleeding, there's slower bleeding, there's oozy bleeding, and that kind of lets us know how quickly we need to help this person. So looking for the source of bleeding is the most important thing. If we think of maybe in the wintertime, it's very cold outside, we have puffy jackets on, that might be hiding a lot of the sources of bleeding that we might need to find and kind of trying to find out where they're bleeding from. So for these patients, we really want to look at, are there multiple places that they're bleeding from? If somebody was injured from a fall, are they bleeding from their arm as well as their head? If they were hit by a car or were assaulted, there might be multiple areas of bleeding. So we don't want to jostle patients around too much when they're on the ground, especially if they're unresponsive, but kind of just using your hand and taking a quick look. Are they bleeding from the back? Is any blood pooling inside of their jacket or clothing? Because these things can really hide life-threatening bleeding. Our C for our ABCs of controlling bleeding is to compress or put pressure on the source. So putting pressure on an area of bleeding is the first thing that we want to do for a lot of our patients that we find bleeding from. So if we imagine a patient had a big laceration on their leg, we want to find whatever we have and be able to put pressure on that wound. Ideally, we would use something like a clean or sterile gauze from a first aid kit, but that's not available. We're going to use whatever that we have right then. Bleeding can lead to death within minutes. So the biggest thing we want to do is find whatever area that we can to control that bleeding. If that's a shirt, a sock, a jacket, we'll use whatever we have to stop that bleeding. And at the hospital, they can really irrigate those wounds and kind of take care of any infections that might happen afterwards. We're going to focus on the location of bleeding. We're going to use just enough cloth or gauze to cover the area. And we want to put down a lot of pressure on the wound until help arrives. So here's a really good video that shows exactly how we want to put pressure on the wound. As you can see from the video, this looks like a wound that's on someone's leg. So this is a shirt that they're using for this. So we're going to put it right on top of the wound. We're just going to fold it over once or twice, not so it's too baggy that we can't push down. And we're going to put down pressure. And again, we want to put down a lot of pressure on this area to really help the body slow down that bleeding and allow the clots to start forming inside of that wound. If we had too much like a really big puffy jacket, we might not be able to put enough pressure on that wound. So we really want to use just enough to be able to put pressure on the wound, and we want to use our body mechanics. A lot of times it might take 2 to 5 minutes for paramedics or firefighters to arrive on this scene. So using our body to lean over and put pressure on that wound is really going to help us out without getting too tired of putting pressure on the wound for an extended period of time. So for large wounds, a lot of time direct pressure might not be enough. So if you have a wound that's very large or very deep, putting pressure on that wound might not be able to slow or stop the bleeding in an adequate way. For these wounds, we want to do something that's called wound packing. So for wound packing, we're going to take whatever source of material that we have, whether that's that sterile gauze, a shirt, towel, whatever we have, and if that bleeding continues to occur with the pressure, we can't stop the bleeding enough, we want to take that dressing and we want to actually pack the wound. So you can see in the images on the screen, we're actually going to take our fingers or our thumbs and use that material, and we're going to push it inside of the wound. So ideally, this is really going to allow us to get to the bottom of that wound and put pressure on the wound from the inside and outside at the same time. Once we pack the wound fully, and we're going to keep packing until we can't pack anymore, and put pressure on the wound, we're going to do the same thing as the pressure of holding our body weight against that wound and hold down for until help arrives, the paramedics or the firefighters. And here is a quick video on wound packing. So again, in this video, they're able to use sterile gauze as they pack the wound. So we see a really deep cut right here that direct pressure would not be able to stop the wound. So again, in this demonstration, we're just going to go hand over hand, and we're going to continue to pack the wound until you can't fit any more gauze inside of the wound. Now again, this will probably be very painful for the patient if they're awake, advising them that this is painful, but this is a necessary step to be able to stop that bleeding and save their life. And then after that, we're going to hold down pressure on the wound. If the wound is very large, you might need to use multiple pieces of gauze, towels, shirt to be able to pack the wound fully. That's completely okay. There's only two things we really would not like you to use to pack the wounds, and that'll be toilet paper and like Kleenex tissue. Those usually dissolve in water and really won't be able to provide that pressure inside the wound to actually stop that bleeding. The third thing that we want to use, if these first two measures of the pressure and the wound packing don't work, the last thing we'll be able to do is use a tourniquet. So this is going to be for a really severe hemorrhage where we pack the wound. Even though we pack the wound and we're putting pressure on it, bleeding is still occurring out of that site and we can't slow it down or stop it. At this point, we're going to kind of use our last option, and that's going to be to stop all blood flow from getting to that wound. If there's no blood going to the wound can't bleed at all. So if we're using a tourniquet, we're going to use a tourniquet. We're going to go about 2 to 3 inches above where the wound is, and that's just going to give us a little bit of room if there's any kind of extra damage internally to make sure that we're able to stop that blood flow from getting to the wound. We don't want to place this over the elbow or the knees. These joints are really difficult to be able to put enough pressure on to go down to the arteries and veins to stop that bleeding. And then we're going to tighten the tourniquets until bleeding stops. We used to advise to tighten the tourniquet till you couldn't tighten anymore, but I think we've gotten a lot stronger, so we're just going to focus on until bleeding stops now. Once the tourniquet's on, we really don't want to remove the tourniquet. We want to leave it on until first responders get there, and at the hospital they can decide what they want to do for their next steps. You can apply tourniquets to yourself or others. So a lot of these tourniquets were created by the military to be able to use one-handed or by ourselves. So they're very handy and very easy to use. They can be applied over clothes. We would recommend removing as many clothing layers as possible to make sure you can really tighten that tourniquet down and really be able to compress those arteries and veins so the bleeding won't occur. If there's something like a puffy jacket on, you might want to remove that, but if it's something like a t-shirt or a long sleeve shirt, that's typically okay to put a tourniquet over. Ideally though, removing the clothing or at least checking underneath to make sure there's no sources of additional bleeding are really important. One thing to let the patient know if they're awake or if you're putting it yourself, that tourniquets are going to be very painful. They're going to be very tight, squeezing down on your arm. There's going to be lack of blood flow going down to that extremity, so this will be painful and painful over time. First responders in the hospital have pain medications they can help you with to assist with that pain. And finally, a second tourniquet may be required to stop bleeding. Sometimes that first tourniquet maybe didn't tighten enough or was not in a great spot. You still have some bleeding occur. You can do another tourniquet. We just want to put it above that first tourniquet, so closer to the area of the heart to make sure that we continue to press down on those veins and arteries and stop bleeding. And here is a quick video that shows how a tourniquet can be applied. So with the tourniquet, we're going to put it on the arm. We're going to wrap it around. And there's a piece of Velcro that goes on the back of it, so it just goes through the strap, and we're going to tighten it down. We don't need to be overly tight with this, but we want it to be pretty close to the skin. We don't really want to be able to fit a finger or two underneath it to allow it to really be able to tighten down. Once the Velcro is on, we're going to turn the stick, and this is where we're going to continue to turn until bleeding stops. This is really the painful part. That's going to be a little discomfort for the patient, but letting them know that this is very important to stop the bleeding. Once the tourniquet is locked into place, it can't loosen anymore because it's locked, and we're going to put a piece of Velcro on top. Ideally, the tourniquets do have a pen that come with it. We want to write down what time that tourniquet was placed on. This really helps the hospital to know exactly how long that tourniquet was on and how long that patient didn't have blood flow going to the extremity. This really identifies if that limb will be salvageable when they get to the hospital. Typically, we have about 4 hours from the time the tourniquet's applied till the when they get to the hospital to release that to make sure that limb is still salvageable. For a lot of fast transports, especially in the area that we're in, that's very achievable of going to the hospital. And writing down the time, just make sure that from the direct source of the person that put the tourniquet on knows what time it was and the hospital can read directly. We want to avoid anything like playing the game of telephone where you told the EMT, who told the paramedic, who told the nurse, who told the doctor. A lot of times those times can get mixed up or mistaken, so just having it right on the source is the best idea. So we like to break down the areas of bleeding into 3 different types on the body. So we have the torso, which you can see on the right in orange. We have our joints and our neck, which will be in green, and we have our extremities, which will be in blue. So if we think about the tools that we found out so far, putting pressure, wound packing, and tourniquets, what areas of the body can we use these on? So if we start out with putting pressure on a laceration or a penetrating injury, just think about it to yourself. Can you use this on the torso of the body? If someone had a big laceration to their stomach, can we put pressure on that to stop bleeding? Yes, absolutely. What about in the axillas, the armpits, the shoulders, the groin, or the neck? If someone had a big laceration or penetrating injury, can we put pressure on that area? Yeah, absolutely. We can put pressure on that area as well. And then finally with the extremities, the arms and legs, we can put pressure on those areas as well. As we move on to wound packing, what are your thoughts on can we do wound packing if someone had maybe a big injury to the chest or the abdomen? Yeah, absolutely. It depends on how big these injuries are, but we can do wound packing in those areas and it can be actually very beneficial for that. You might need more material than it was something in maybe the hand or the leg, but we do want to use wound packing in those areas. That's going to apply for the joints as well. For the neck, for the armpits, for the groins, we want to do wound packing in those areas, and that applies to the extremities as well. So this is where things get a little different. So we think about using a tourniquet. So when we use a tourniquet, we're wrapping the tourniquet around someone's body and tightening it down to stop blood flow. Would we want to use that on someone's abdomen if they had a big cut on their abdomen? Yeah, so tourniquets aren't really great on the abdomen. We don't really want to cut off all circulation, and we're not going to be able to get that tourniquet tight enough around the abdomen, and that's going to stop all blood supply going down and up. Now, do we want to use it on the groin or the shoulder or armpits? Well, this is kind of like what we talked about where you don't want the tourniquet over the elbows or the knees. This area is not great because you're really not be able to put a lot of pressure on those areas. And if someone has a big laceration in their armpit or their shoulder, you won't really be able to get 3 inches above that area to put that tourniquet on and tighten it down and really get the response that you would need of kind of shutting down that blood supply. And again, around the neck, probably not a great idea either, as that's what's feeding our brain. So we don't want to put a tourniquet around the neck either. So tourniquets really are used for the extremities. So the arms and the legs are the best thing that you want to use tourniquets for. They're really easy to put on. We're okay stopping blood flow from one of those extremities for a few hours to really stop that bleeding, because that can kill you. So you can get to the hospital so they can repair any kind of vascular, arteries, veins, muscles, and be able to stop that bleeding and then restore blood supply to those extremities. Bleeding in children. So all but the extremely young children, the same tourniquets can be used. So again, when you have a tourniquet, there's a metal or a plastic plate on those tourniquets that kind of determine how much of an area can go around. So if you have like a toddler, their arms or legs might be a little bit too small to fit that tourniquet around. And again, for the most part, a lot of times that direct pressure and wound packing works really well, especially in really young kids or toddlers. Anything older than that, if a tourniquet can't fit around their arm or their leg, it can be used in kids as well. And again, the same techniques that we used in adults can be used in children for the pressure and wound packing as well. And here are some frequently asked questions that we normally get throughout the presentation. Impaled objects. So we really want, if something is impaled inside of the patient, whether it be a tree branch, a piece of rebar, knife, anything like that, once something is inside the patient, we really want to leave it inside the patient. A lot of times the body can help put pressure around those impaled objects and actually have minimal bleeding because of that. If that object is pulled out, at that point the bleeding can occur a little bit more. It could be more painful, and that's where we have to use a lot of these techniques to stop bleeding. Unless it's in their way of the airway, but a lot of times first responders will help you with that when they arrive on scene. Improvised tourniquets. So improvised tourniquets is usually best to use a tourniquet that we do have, like a cat tourniquet or one that you can order that's specifically made to be a tourniquet. But in worst case scenarios, you could use something to improvise. This could be something like a shirt that could be wrapped around the arm or the leg, and then a stick or something solid through where you can continue to twist and tighten it to kind of shut off blood supply to that extremity. A loss of an arm or a leg is always a question as well. If there's an amputation, a lot of times the body is able to clamp down on those arteries and veins with an amputation, but there still can be significant bleeding, so you can use a tourniquet on those as well. And again, I think we covered it a few times, but a lot of these techniques that we're going to be using on these patients, whether it is direct pressure, wound packing, or tourniquets, these are going to be very painful. Again, we just want to advise the person that these are very painful. This might hurt, but again, this is a life-saving technique, and we really want to stop or slow that bleeding down to be able to get them to the hospital for life-saving care. In summary, the first thing that we always want to look out for if someone is hurt or injured is our personal safety. Let's make sure that we're safe when we're showing up to help them, whether that's through bloodborne pathogens or whether that's through the scene that might not be safe. We're going to call 911 and identify where our location is and what type of help we need. We're going to go through the person's entire body and find where the bleeding is coming from. We're going to compress with pressure and or packing, and then we'll use the tourniquet if we need as well, and wait for help to arrive. But a lot of times first responders should be there within minutes and be able to help take over care of the patient. For more information, you're welcome to visit stopthebleed.org. We additionally host Stop the Bleed classes at the hospital or in the community from Washington Hospital as well.
All right. Thank you very much, Garrett. We do have a couple questions. The first question is, how long do you apply pressure before moving on to the method of packing the wound or onto a tourniquet?
Oh, that's a great question. So we wish medicine was a little more black and white for us to be able to actually say this is exactly how long that we want to put pressure on, or this is the kind of steps you would take, wait 30 seconds and go on. It's really difficult though. If you're putting pressure on the wound and while you're putting pressure, blood is continuing to fill up maybe that shirt, that piece of gauze, and continue to pour out, and you feel like no matter how much pressure you're putting on, you're really not slowing down that bleeding, you can move on to that next step immediately. And the same thing with the tourniquet. Again, these are steps that we use for the layperson to identify what life-threatening bleeding looks like and how to help them. While these steps are ABC of, start with pressure, go into wound packing, and then a tourniquet, if you identify something that's bleeding really quickly, you might want to skip just to the tourniquet for that patient as well. If you notice maybe they're unconscious or going unconscious, or the bleeding seems so severe you probably wouldn't be able to stop it with pressure or wound packing, you could jump straight to a tourniquet. So again, use your best judgment when you show up on these scenes. And we're really, as a layperson out there, we're just trying to help this person, buy them a few more minutes until professional help arrives that's been trained. So whatever you do is going to be very beneficial for the patient. Just by showing up and trying one of these techniques will be beneficial.
Thank you. We do have another question. What if I don't have a sterile gauze or a clean t-shirt? Is it okay to use any other t-shirt? Or
That's a great question. Again, we worry sometimes about infections. So if we have maybe like a rag that's in our car or the sock that we're wearing or anything else, there is a chance that infections can occur with that, but that's something that will happen later on down the line. If we don't do something to stop that bleeding right away, that patient could die before we can kind of lead to an infection. So whatever we have right then, we want to use that kind of towel, rag, shirt you're wearing, even if it is dirty, to be able to put pressure on that wound and slow that bleeding down or start to stop it. At the hospital, they're going to irrigate these wounds a lot. They're going to clean everything out. They'll do antibiotics to really make sure everything's clean afterwards. So our biggest priority is going to be, what can I use to stop this bleeding immediately? And then everything else can be worried about at the hospital after that.
Okay, thank you. Our last question is, where can I purchase a tourniquet?
Oh, that's a great question. So Stop the Bleed has a Stop the Bleed kit. So if you go to stopthebleed.org, they have a great Stop the Bleed kit that's on there that comes with gauze, tourniquets, and other packing and bleeding material. It's really great to keep in your backpack, in your car. It's just something that you might not ever need it, but it's always really great to have with you just in case. And that would be our recommendation, to use the official Stop the Bleed kit.
Great. This is great information. And thank you, Garrett, for this insightful presentation. This does conclude our program. Thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on the Washington Health YouTube page.